Director of Peoria City County Health Department, our administrator, and she'll be taking a quick update, situational update on the COVID-19, and then asking for any questions and answers. We have Dr. Stoner here in case there are some additional questions, and you can point as well.
Dr. Saders.
Dr. Saders, yes, thank you. Go on.
Okay.
So, good afternoon. Today, as we saw from yesterday on the national stage, as well as some state and local conversations, we felt that it was imperative to make sure that the communication is open and available for the public and utilizing our media in our area. And so with that, we're going to be standing up a routine press conference at 4 o'clock Monday through Friday, at which point we will answer any questions as well as provide any guidance that was updating, because as we recognize this is a very much evolving situation. Very fluid is a term that's often used, and with that, things that may be set in stone or discussed one day can quickly change by the hour or by the day. So we want to take advantage of having a standing meeting with our press and to make sure that we can inform the public of any of those changes. And then there's some questions about locally what we're seeing here. Currently we have 0 confirmed positive cases. In our area, we have tested 2 individuals that both came back negative, and we have currently 2 still pending. Those numbers only reflect Peoria County. This is a regional area, and our hospital systems are much more on a regional side. And so with that, the true numbers that we see in terms of testing is much higher than that because we are such a hub for our area. Those are for our persons under investigation. However, there is ongoing contact tracing. We're talking to individuals that have returned from abroad or might have traveled from areas that are considered of high risk. And so we have contact tracing wise locally. We have done over 10 individuals, and that continues to grow as this response continues throughout our nation. So with that, I'm going to turn it over to Dr. Stoner, who is the Medical Director for the Peoria City County Health Department, and talk a little bit more about the testing as well as more about COVID itself.
Good afternoon. I kind of wanted to personalize this and give you an example of what really is involved in testing someone. And so if someone comes in to a doctor's office, or they've called in and said and told to come into the doctor's office, the things that we look for are someone with a travel history, of course, and people that have symptoms of high fever and cough or shortness of breath. And so the idea is to sort out which people actually need the COVID-19 testing and to become labeled persons under investigation. So what is done is usually an assessment of that patient, and then if we think they need to be tested, we want to rule out other things first on examination, and often by doing influenza testing that can be done in the office and also in the urgent cares and in the emergency department. And again, we're not encouraging everyone with a cough or fever to run to the emergency department. Just the opposite. You call your doctor and get advice. So when we look at people that come in with symptoms like that, we would rule out influenza, and then there's another panel that can look at multiple other viral diseases. And also if you think someone might have a bacterial infection, you do cultures. But when you think someone might have this because they have the right travel history, or they've been in contact with someone that has known to be positive for COVID-19, then 2 things are done as far as one is a nasal pharyngeal swab and the other is an oral pharyngeal swab. And those are put in a viral transport media, and the health department is contacted to see if they will run that COVID-19 test. And then they're assigned a number, and then those samples can be brought in and then analyzed at one of 3 spots. One is Chicago, the other is Springfield, the other is Carbondale. Those are the state testing labs for doing COVID-19 testing right now. So we break things into the different kinds of symptoms and what qualifies for a person under investigation. I have them written down here so I can get them right. Fever are signs or symptoms of lower respiratory illness. including any person, including healthcare workers who've been in close contact with laboratory-confirmed COVID-19 patients within the last 2 weeks. The other would be a fever and signs and symptoms of lower respiratory infection, cough and shortness of breath requiring hospitalization, and if they have a history of travel from an affected geographic area within 14 days. So that would include China, South Korea, Iran, Italy, and Japan. And then the third category would be people with severe acute respiratory problems, and they're requiring hospitalization. And even if they don't have a source of exposure known, they can be tested, but you still have to rule out the other causes of that shortness of breath and cough and fever. So that's the current approach to identifying patients that need testing. And I'd like to ask Dr. Sater to talk a little bit about the hospital's response and their kind of population health management. So, Dr. Sater?
Thank you. So when we have a situation like this, it's really a management of resources. What people sometimes forget is we still have all our heart attacks, all our regular influenzas and pneumonias. We have stroke patients coming in, and then we have a crisis like this. And the goal of what the health department is doing, the goal of what the nation is doing, is trying to lower the peak of the cases. So we're not trying to eliminate the COVID-19 virus and have zero infections. We know that's not a realistic goal. But if we have, for example, just 100 ICU beds, and we use normally 80 of them, 90 of them in our entire city, and all of a sudden we have this new infection and it adds 50 more or 100 more, in that case, we really lose patients because we don't have the capacity to care for them. In a country like Italy, which is similar to us, when they got overwhelmed, that's when the fatalities start to increase. So you have more people passing away just because we may not have the resources to care for them. So what we're trying to do is lower that peak. So when we restrict travel, when we restrict the number of people going to the emergency rooms, when we restrict the number of people visiting nursing homes or the hospital, when we say don't congregate in large numbers, the goal is to spread out the infection. Meaning that yes, we will get infections, but we may not get the total number very high over a short period of time. If we accomplish that, the chances that the mortality rate will be significantly lower than what you see in the media currently or what you hear from hotspots like Italy are significantly better. So we want to ultimately follow a pattern like Taiwan and Korea, who are very adept at having that social distancing occur and have a low mortality rate. That's our goal. And with that, I'll take questions.
This testing process is extremely cumbersome.
It is.
From patient coming in and saying, I want to be tested, to when they actually do get tested for COVID-19, how many days is that?
So that takes quite a few days.
Okay.
The testing is run, I want to say, maybe once a day, and the test has to go from whichever area to that lab. I'm not an expert on that end. I got my colleagues who are actually managing the testing, but let me put it in a different way. If you test positive, would I do anything different? And the answer is no. If you have a cold, a fever, and a cough, try to isolate yourself. If you're really short of breath and you can't breathe, by all means, visit our emergency departments. But the reality is, I don't have a medicine to give you that will make it go away or get better quicker. So what we're really looking at is, if you're positive right now, we want to trace it so that we know who's at risk. At some point, we're not going to trace all those people, but we will tell you, isolate yourself. And if you're really sick, we will have you come into the emergency departments. So the testing is good right now because it helps us narrow down the population of people that we need to worry about. But whether the test is positive or negative, we will likely treat you the same way.
How many days between when somebody comes and says, I want to test, to when they actually do get tested?
can answer that one a little bit.
So
So it's not as simple as someone requesting it themselves. So
I
it-
understand.
So it has to be with coordination with your healthcare provider, because there is a limited amount of tests. So you are prioritizing testing for those individuals, as Dr. Stoner mentioned, that have a travel or contact exposure, or they themselves are one of those high-risk population that if they are positive for COVID, we want to try to do some intensive care so that they don't transition into a fatality statistic. And so it is still being prioritized in terms of testing. Once a provider identifies an individual that needs to be tested and coordinating with that local health department, the turnaround time is about 1 day, about a little bit less than a day, and it can be as short as 12 hours depending on all the parts that are on the same pace. And so it is really a rather quick turnaround time. But again, the key thing to understand is that it is a provider's recommendation that someone should be tested, and that we ask individuals that think that they might have it to call their provider first. All of our healthcare, large healthcare agencies, whether it's Unity Point, Heartland, and OSF St. Francis Medical Center, are utilizing their nurse triage system effectively, as well as even our 911 systems and 211 are now adapted to allow for screening and helping people assess their needs. But as the doctors mentioned, for most people, we don't have a vaccine, we don't have medication. It's going to be self-care and be managed at home with fever-reducing medications, rest and fluids.
Right, but during that whole time, this person is walking around in the community thinking, oh, I have a cold, and they don't, they have COVID-19. So when you talk about trying to limit the number of infections in the community, it seems to me like the key is testing everybody who wants to be tested. When are we gonna get enough tests?
So testing is one portion of it. The other are those non-pharmaceutical interventions, such as good hygiene, social distancing, if you're an at-risk population, taking and trying to minimize your risk. Because you're exactly right, there are not enough tests currently available, and because they're prioritized, the need is to practice those non-pharmaceutical interventions, such as covering your cough, cleaning your hands, and definitely containing yourself if you are ill.
I think there's a lot of confusion with the general public with, okay, I think I have this. What is step 1, 2, 3? I know you say contact your provider, but sometimes they're told, no, contact the health department. What are the simple steps? And then what should someone do if they don't have a primary care provider?
So the first step will be to contact your provider. Local health departments are more involved in terms of the back end when it's regards to testing as well as providing guidance and support. But here locally, and I can't speak for the full state because different health departments have different models, but here locally in Peoria, as well as in Tazewell and Woodford County, if you are experiencing symptoms and you're concerned, you should be contacting your healthcare provider. Now, agreed, if you are not sure, you don't have a healthcare provider, a great resource is Heartland Health Services. Heartland Health Services, as our federally qualified health center, also has a nurse triage system and is available to take those calls. And all that information is available through 211, which is again a great resource that we have in our community.
So I know one of the big kind of things that we talked about in terms of if you qualify for the testing is travel, to these specific countries where we've seen these major outbreaks. It's starting to spread kind of across the country. When do we think that this kind of travel requirement is going to start to not be as important?
That's a great question, and I think that is why this is such important to have these daily updates with our public, so that when those guidances change, that we can update the community about that. Right now, we're seeing a lot more still travel-based transmission, and there is the chance that it goes and continues, as mentioned, to more community-based transmission. And so every step of the way, we'd be assisting and looking at. And actually, the CDC on Tuesday gave wonderful guidance around mitigation. I think that has helped a lot of communities, not only here locally, but throughout the country, really have those dialogues about at what points to be transitioned to different phases of response.
So we see, nationally and locally events being canceled, postponed, the colleges leaving, and I know, we have no confirmed cases here yet, but I guess if you could explain to, the general public that thinks, well, if we don't have any cases here, why is this happening? How this is more preventative.
I think if you want to mention to that, I think that's a great response from the population, the healthcare response.
It's because we believe that we will have cases. And if we reduce the spread, how fast it spreads, because if we allow it to spread like wildfire, it will cause those really high peak numbers. So that's the goal of all those maneuvers, eliminate large gatherings, because one person can be kind of like the nidus for hundreds of people being infected. So if we can avoid that, we want to try to avoid that. And I'll address a little bit if I have a regular cold or the influenza B or influenza A. My challenge to the community is influenza A and influenza B can be deadly for people at risk and elderly population. So whether you think you have the cold or COVID-19, doing those non-pharmaceutical interventions are good for the entire community. So I don't want my grandfather to get influenza B, influenza A, or COVID-19. They can all be equally deadly for that person. So that's one way to address that concern.
What are the key differences between influenza and COVID-19?
I wish I could tell you all the microbiology. We think that the mortality rate is higher with the COVID-19. And you can think of it as a new disease, so our immune system may not be up to speed with it. How much higher is the mortality compared to influenza B this season? That's really difficult to tell, and it's hard to compare countries to countries. So when we get a number from China, Iran, or Italy, you can start to extrapolate a little bit, but it's not a hard number. We will know in retrospect. In a year, we can probably tell you it was this much higher or it was the same. It is hard to say today.
So at what point, I know a lot of the school districts around here are currently preparing e-learning days or some variant of that using snow days, emergency days, so on and so forth. And the health department, I believe, if I'm not speaking out of turn, is not currently recommending schools shut down at this time. I mean, is there a point that comes where you say, yes, you need to consider not having kids physically in class?
So, Monica.
I think Dr. Stoner would have found another one.
So the CDC gives guidelines on that, so that's a great question, because you want something that's kind of evidence-based, as much evidence as you have, with a really kind of defined plan that can be used nationally. And so they have 3 different grades of, that they look at, and we are currently in the preparedness grade, because we don't have any cases. But they have very strict definitions of when you have this number of cases within the community, then these are the steps you take as far as school closings, limiting public gatherings, even limiting church attendance and things like that. Okay, so they've given us really good guidance. We reviewed that guidance 24 hours ago, actually, as far as our group, to make certain that we're following all those things. So we do have recommendations on that we are following.
So what are those next 2 stages, and how do you determine when you move from stage 1 preparedness to stage 2, stage 3?
I think it goes through your community transmission points. So as we've commented on, the biggest takeaway is that people will eventually be exposed to COVID-19. Our game plan here in Peoria and in our state and as a nation is, as I think both physicians have mentioned, is that we are trying to extend this out so that it never reaches a peak that overburdens our system and causes even a larger issue. And so with that, it's really understanding how much of a community transmission we get, and those are the points. And right now, regionally in our area, we haven't had a confirmed case. Again, that can change tomorrow. And I will say that the Regional Office of Education, as well as our large school districts, have been in communication with us consistently to monitor and also give us feedback of what they're getting from their staffing as well as from their parents. Because I think another thing to recognize with our school districts is not only are they school districts, but they're also large employers. So they also have to be balancing the fact that they have a large staff and they should be monitoring their staff as any other employer does too. So the guidance gives us frameworks, and we apply it when we see what our needs are locally and what those kind of capacities we see in our healthcare providers where it does exceed that level. And every community is slightly different, so it's always going to be a local decision. And we are very advantageous that we started our Joint Emergency Operations Center, which allowed us to start that communication between the city and county and all of our entities to really share information so that we are fully understanding what our partner agencies' ability is to respond.
I'm happy to give you a copy of it
Yeah,
if you'd like.
absolutely.
But in essence, it's not a really simple answer to that.
Gotcha.
okay?
One thing I've been wondering about, so let's say I live in East Peoria, I come over across the river, go to the St. Francis, or I go to Methodist, and I get tested there, and I'm tested, you know, do I count as part of Peoria County's testing statistics, or Tazewell's, or both?
That's a great question. So first and foremost, your regional health departments are working together and we are always in communication. We will maybe start the case, but it is transferred to the individual's resident county. So if you are a Tazewell County resident, we might start the investigation, but not, without said, that would be transferred over to that county to follow up and do the contact tracing and the monitoring of those individuals. But we have a really strong coalition here between the 3 health departments and our hospital systems, and it's just something that in a situation like this has been advantageous for us.
What's the investigation process like?
So it really depends on what point we're seeing an individual and where they are in the investigation. Are they a confirmed case? Are they have an exposure to a known contact? If someone is, for example, coming from traveling, which is what we've seen a lot of individuals here reporting, what we end up asking them is where they came from. Are they symptomatic or not symptomatic? If they are symptomatic, then we ask them to call their health provider and start that process that Dr. Stoner mentioned about assessing with their provider and then those follow-up tests if need be. If they're asymptomatic, then we ask them to self-quarantine at home and monitor their symptoms. And in the age of technology, which has been advantageous, we actually send them an electronic survey where they monitor their symptoms and submit that on their own daily with us. And then we do checks-ins with them as it goes on. And so through that process, we can monitor some of our contacts, as well as individuals that are under investigation.
And Monica, one additional question. You were on the 21st show on NPR earlier this week. I believe you said there were about 10 people quarantined in Peoria County. Is that still about the same number?
It fluctuates and it's self-quarantine. It's a terminology that we like to clarify between isolation and quarantine. The practices are the same, where you want to socially distance yourself from individuals and have minimum contact. But quarantine are individuals that have no diagnosis but have a possible exposure and risk versus individuals that are isolated. And so in give and take in our region, we fluctuate anywhere from 10 to 15. And a lot of it then again is based on people returning from travel, recognizing they're coming from Italy or coming from abroad or a different state and wanting to make sure that they are protecting the community.
And is that 14-day self-quarantine?
It is, but it's the day of their known exposure. So for example, if 10 days ago I had been exposed or just returning from overseas, for example, Italy, then I will still have another 4 days on my, if I still have been asymptomatic or without symptoms the whole time, then I would have maybe just more 4 days of quarantine. Well, with that, thank you all, and again, this is going to be a standing press conference at 4 p.m. Mondays through Fridays, and if there are any changes, the Central Illinois PIO group, either Diana Scott or some of the other PIOs in our areas, will notify you if there are any changes. Thank you.